Good morning, good afternoon, good evening, everyone. My name is Kiyomi Takahashi from Sasakawa Health Foundation. Sorry, I was muted, sorry. Thank you so much for your participation in our webinar. Don't forget leprosy, role of health professionals at the grassroots level. This webinar focuses on the efforts of healthcare professionals at the grassroots level amid the pandemic, give recognition to the work they are undertaking, and introduce some success stories with the aim of developing measures that can be adapted to each region. The webinar is a side event of Global Peel 2022. Before it starts, I would like to announce 2 points. The webinar is conducted mainly in English, and we have simultaneous interpretation in 6 languages: Hindi, Nepali, Bengali, Indonesian, Portuguese, French, and Japanese. If you require language interpretation, please click on the translator icon available on the screen. Also, if you have something to ask to the panelists, please open the Q&A window on the screen and write questions. Now we would like to start the webinar. First, we would like to have an opening remarks from Mr. Sasakawa. He is the chairman of the Nippon Foundation and WHO Goodwill Ambassador for Leprosy Elimination. Mr. Sasakawa, it is a pleasure to have you on the floor.
会長どうぞ。はい、お願いします。
僕
はい、大丈夫です。
皆さん、日本時間ではこんばんは。そして皆さん方、こんにちは。WHO のハンセン病大使の笹川洋平でございます。お忙しい中、お集まりをいただきましてありがとうございます。特に今日はビロード・カティワダ、ネパールの保健大臣からもメッセージをいただいております。また、ご多忙の中、アンジュ・シェルマンさん、そしてドクター・アニール・クマールさん、ドクター・インドラ・ナビットさん、ドクター・ラビンドラ・パスコタさん、デニッシュ・バスネットさん、そしてドクター・ラオ・ベン・マラジュさん、ご参加をいただき、またこのウェビナーに参加してくださった多くの方々に心から御礼を申し上げます。実りある会議にぜひしたいと思います。このウェビナーは笹川レプロシーイニシアティブという名前で、こういうコロナの困難な時代でございますので、なかなか現地でお互いに会合を開くこともできません。従いまして、このウェビナーを使って、やはり多くの患者さんを探すこと、あるいは回復者の皆さんの生活がどうなっているか、何が今問題なのかということをコロナの中でも私たちは休むことなく関係者が一致団結して仕事をしていこうということで Don't forget leprosy というキャンペーンで、させていただいております。 皆様のところに、マークがありますかね。ないか。車のマークはわからない。
ないですね。
ないね。じゃあいいや。また、私が2006年からグローバルアピールというものを発表してきました。今年は世界の有名な社会活動をしている財団の皆さん方にこのアピールに参加していただきました。なぜ私がそういうグローバルアピールというものを出すようになったかと言いますと、やはり私たちのレプロシーに関与する我々の声をもっと大きく世界中の皆さんにレプロシーの正しい知識、そしてましてや偏見や差別というようなことが人権上の問題としてあってはならないわけでございまして、そのためには私たちの声だけでは十分じゃないということで、まず第1回目は世界のノーベル平和賞をもらった方々にダライ・ラマさんですとか、アメリカのジミー・カーター元大統領ですとか、デズモンド・チツさんとか、有名な方々に参加をしていただき、この世界発信をいたしました。それから毎年、世界の宗教指導者、キリスト教、あるいは仏教、ヒンドゥー教、イスラム教、さまざまな宗教指導者がやはりこのレプロシーの問題を正しく理解をしていただく。ましてや病気が治った人に相変わらず差別を続けることは良くないことだ。こういうことを世界的なリーダーに発言してもらうことで、このレプロシーの問題を世界的な問題にしたいという私の気持ちからやってきたことで、ございまして、今年はそういうことで、世界の大きな財団の皆さんの指導者に参加をしていただいたわけでございます。そういう中にありまして、このコロナという世界的なですね、感染力の強い病気の発生の中にもかかわらず、お働きをいただいている方々のお話をぜひ承りたいというふうに思っておりますし、私自身も皆様方の率直な現在のその悩み、あるいは素晴らしくうまくいっている成功例等々をお聞かせいただきまして、今回はインドとネパールでございますけども、私たちはこれをアフリカ、あるいは南米、あるいはインドネシア、世界中のところにですね、皆様方のお働きをお伝えし、また参考になる意見をお伝えすることによって、世界中がこのコロナの中でもレプロシーの患者発見のために、そして彼らの生活の中に差別からの解放をするという、こういう多分アフターコロナの時代は人々の多様性を認める時代になっていくだろう。私は確信を持っております。そういうことで今日は 皆様方のご活動、そして問題点を率直にお話し合いをさせていただき、また私たちがそれを世界にお伝えし、世界中からインドのモディ首相がおっしゃってますが、2030年にはハンセン病を世界から、レプロシーを世界からなくそうという動きを単にインドだけではなく、世界中で実現したいものだというのが私たちの大きな目的でございます。どうぞよろしくお願いいたします。ありがとう。
Thank you very much for your remarks, Mr. Sasakawa. Next, we'd like to view the video message from the Minister of Health and Population of Nepal, Mr. Bilodo Katiwada.
नेपालमा लामो समयदेखि कुष्ठरोग जनस्वास्थ्य समस्याको रूपमा रहिआएको छ। सन् 1966 मा करिब 1 लाखभन्दा बढी कुष्ठरोगको बिरामी पहिचान भएसँगै नेपालमा ड्याप्सन मोनोथेरापी नमुना परियोजनाको रूपमा कुष्ठरोग नियन्त्रण कार्यक्रम सुरुवात भएको थियो। विश्व स्वास्थ्य सङ्गठनद्वारा सुझाइएको बहुऔषधि उपचार कार्यक्रम भने 1982 बाट थाल्ने भयो। यसको गम्भीरतालाई ध्यानमा राखी कुष्ठरोगका कार्यक्रमहरूलाई आधारभूत स्वास्थ्य सेवामा सन् 1987 मा एकीकृत गरियो। नेपाल सरकार स्वास्थ्य तथा जनसङ्ख्या मन्त्रालयको निरन्तर प्रयत्न र कार्यबाट सन् 2009 मा राष्ट्रिय स्तरमा कुष्ठरोगको दर प्रति 10,000 मध्ये 0.77 प्राप्त गरी सन् 2010 मा आधिकारिक रूपमा नेपालमा कुष्ठरोग निवारण भएको घोषणा गरियो। नेपाल सरकारको नीति तथा योजनामा कुष्ठरोग निवारणलाई सधैँ प्राथमिकतामा राखिएको छ। उच्च राजनीतिक दृढता, सङ्घीय, प्रादेशिक तथा स्थानीय सरकारको बढ्दो चासो, यस रोगलाई प्राथमिकतामा राखी इपिडेमियोलोजी तथा रोग नियन्त्रण महाशाखा अन्तर्गत कुष्ठरोग नियन्त्रण तथा अपाङ्गता व्यवस्थापन महाशाखाबाट नियमित कार्यक्रमहरू सञ्चालन भएको हुँदा पनि यो सम्भव भएको हो। साथै आधारभूत स्वास्थ्य सेवामा एकीकृत गरी कुष्ठरोग सेवा निःशुल्क प्रदान गरिनु, सम्पूर्ण स्वास्थ्य संस्थाहरूमा बहुऔषधि थेरापी उपलब्ध हुनु र कुष्ठरोग निवारणका लागि विभिन्न साझेदार निकायहरूबाट सहकार्य राष्ट्रिय कुष्ठरोग नियन्त्रण कार्यक्रमका सबल पक्षहरू हुन्। कुष्ठरोग मुक्त नेपाल परिकल्पना साकार गर्न अत्यन्त चुनौतीपूर्ण भए तापनि हामी लक्ष्य प्राप्तिका लागि निरन्तर प्रयासरत छौँ। विभिन्न तहका स्वास्थ्य कर्मीहरूको क्षमता अभिवृद्धि, भौतिक पूर्वाधारहरूको पर्याप्त व्यवस्थापन, निगरानी, अनुगमन तथा मूल्याङ्कनहरूलाई सुदृढीकरण, कुष्ठरोग प्रभावित व्यक्ति र उनीहरूका परिवारको सशक्तिकरण, साथै भेदभाव न्यूनीकरण र पुनर्स्थापनामा थप सुधार गर्नुपर्ने क्षेत्र हुन्। यसलाई सम्बोधन गर्न नेपालले विश्व कुष्ठरोग रणनीति, नेग्लेक्टेड ट्रोपिकल डिजिजेज रोडम्याप, दिगो विकास लक्ष्य लगायतका अन्य अन्तर्राष्ट्रिय प्रतिबद्धतामाहरूमा आधारित राष्ट्रिय कुष्ठरोग रणनीति र कार्ययोजना तयार गरिसकेको निवेदन गर्न चाहन्छु। एकातिर कुष्ठरोग निवारण हासिल गरी दिगो बनाउनु पर्नेछ भने अर्कोतिर हाम्रा पूर्वाधारको सशक्तिकरण तथा राष्ट्रिय तथा अन्तर्राष्ट्रिय सञ्जाललाई थप मजबुत तथा समन्वयात्मक बनाउनु पर्ने देखिन्छ। कुष्ठरोग निवारणका लागि अन्तर्राष्ट्रिय निकायहरूबाट भएका प्राविधिक सुझावको उच्च मूल्याङ्कन गर्दछु। कोभिड-19 महामारीको बेलामा हरेक तहका स्वास्थ्य कर्मीहरूले देखाएका पेसाप्रतिको निष्ठाको उच्च सम्मान गर्न चाहन्छु। कुष्ठरोगको औषधिको निरन्तर आपूर्ति, कोभिडको महामारीको समयमा पनि स्वास्थ्य संस्थाबाट नियमित सेवा प्रदान गरिनु, कुष्ठरोगका बिरामीका लागि पर्याप्त मात्रामा औषधिको वितरण आदिले गर्दा महामारीको समयमा पनि नेपालले कुष्ठरोग कार्यक्रमलाई निरन्तरता प्रदान गरेको अवगत समेत गराउन चाहन्छु। अन्तमा कुष्ठरोग निवारण सम्बन्धी लक्ष्य प्राप्तिका लागि नेपाल सरकार पूर्ण प्रतिबद्ध छ। कुष्ठरोग एकबाट अर्कोमा नसर्ने अवस्थामा पुर्याउन थप समन्वयात्मक पहलको आवश्यकता रहन्छ। यस महत्त्वपूर्ण कार्यक्रम आयोजनाको लागि आयोजकलाई हार्दिक धन्यवाद दिन चाहन्छु र शून्य कुष्ठरोग प्राप्तिको लागि हार्दिक शुभकामना।
Good afternoon, everyone.
Now it's time to move to the sessions. The first is the case finding in India amid the COVID pandemic. We have two presenters First, we'd like to invite Ms. Anju Sharma. She is an accredited social health activist, ASHA, working in Delhi. We will also have Dr. Rashmi Chopra interpret Ms. Anju consecutively. Ms. Sharma, Ms. Rashmi, please, the floor is yours.
Good afternoon, everyone. My name is Anju Sharma. I am working as a ASHA field worker at Shahadra in Delhi for last 5 years. आज मेरी बातचीत लेप्रोसी फाइंडिंग पर हो रही है कि कैसे हम कोविड महामारी के दौरान भी नेशनल लेप्रोसी एजुकेशन प्रोग्राम के तहत लेप्रोसी की स्क्रीनिंग करते हैं.
Ms. Anju is saying that in spite of the COVID pandemic, the activity of case finding for leprosy have been ongoing.
हम अपने फील्ड में रूटीन सर्वे के साथ-साथ कम्युनिटी एजुकेशन एंड एक्टिविटी केस डिटेक्शन एक्टिविटीज करते हैं. हमें कुछ रोग के
During the routine activity of the field for the health department, she is continuing to look for cases of leprosy in the field.
हमें कुष्ठ रोग के सर्वे और कार्यों को करने के लिए प्रशिक्षित किया गया है. हम घर घर जाके लोगों को कुष्ठ की जानकारी देते हैं. कोविड पैंडेमिक के दौरान भी हम कुष्ठ रोग के साथ-साथ कोविड से कैसे बचे यह भी बताते हैं.
She has been trained for detecting cases of leprosy. So during her activity in the field, she visits house to house and educates the people about leprosy.
कोविड के दौरान लोगों को मास्क लगाने को कहते हैं, हाथों को साफ रखने, साबुन पानी से धोने को रखने को कहते हैं, सैनिटाइजर का प्रयोग करें.
She teaches the people to use the mask, wash the hands, and use the sanitizer to protect them from COVID.
कोविड बहुत बढ़ रहा है, इसलिए हमारी परेशानियां भी बहुत बढ़ रही हैं. अब लोगों की लेप्रोसी स्क्रीनिंग करने के लिए जब हम जाते हैं तो लोगों को बहुत अधिक समय लग रहा है लोगों की स्क्रीनिंग करने में, क्योंकि हमें स्क्रीनिंग के साथ-साथ कोविड की सावधानियों का भी पालन करना पड़ता है.
COVID is increasing. My responsibilities are also increasing. When I go to work for leprosy and to screen patients, it takes me a lot of time, a lot more time than before, because I have to follow the COVID protocols.
लोग स्क्रीनिंग के लिए जल्दी से तैयार नहीं होते, फिर भी उनके सभी डाउट्स क्लियर करके उन्हें लेप्रोसी स्क्रीनिंग के लिए तैयार करते हैं, क्योंकि शुरुआती दौर में कुष्ठ की पहचान और इलाज करने से विकलांगता को आगे बढ़ने से रोका जा सकता है. इसलिए कोविड पैंडेमिक में के समय भी लेप्रोसी का सर्वे रुका नहीं.
During this pandemic, people are hesitant to be examined and they are not very welcome in their attitude when she visits them. But then I try my best to convince the people, explain to them that I am taking the measures to protect them from COVID. She clears their doubts, and then it is very important that leprosy is detected early to prevent the deformities. If I do not carry out this screening now, it will be very difficult to prevent the development of disabilities. So even during the pandemic, I am continuing with the screening of patients for leprosy.
हम अन्य कार्यक्रमों की तरह ही हम अपने पहले क्षेत्र के लोगों से मिलते हैं, फिर उनका अभिवादन करते हैं और उनको उचित जानकारी. मैं पिछले 5 साल से अपने क्षेत्र में यह कार्य कर रही हूँ, इसलिए लोग हमें जानते हैं और आमतौर पर किसी खास परिचय की आवश्यकता नहीं पड़ती।
When I meet people, I greet them. I don't need much introduction in the family because the people of my area, they recognize me as I have been working for more than 5 years. I greet the people and people listen to me.
फिर हम लोगों को कुष्ठ रोग के बारे में बताते हैं, उनको अवेयर करते हैं, जानकारी देते हैं कि कुष्ठ रोग क्या है और वह कैसे फैलता है। हम बताते हैं कुष्ठ रोग एक पुरानी संक्रामक बीमारी है जो बैक्टीरिया माइक्रोबैक्टीरियम लेप्रे के कारण होती है। यह किसी संक्रमित व्यक्ति के खांसने या छींकते समय जो ड्रॉपलेट्स निकलते हैं उनके कारण फैलती है।
In the field, when I go, I teach the people about leprosy. I tell them that this is a communicable disease caused by the bacteria, Mycobacterium leprae. I tell them that it spreads only from people who are not treated. And I try to explain to them that the disease is curable.
यह मुख्य रूप से नसों और त्वचा को प्रभावित करता है। मैं कई बार एक पैम्फलेट लाइक दिस टाइप ऑफ पैम्फलेट अपने साथ रखती हूँ, जिसे मुझे लोगों को समझाने में आसानी रहती है कि इसके कुष्ठ के रोग और लक्षण क्या हैं और वह आसानी से समझ भी जाते हैं, उनको समझने में आसानी रहती है। और फिर हम एक एक करके लोगों की लेप्रोसी के रिगार्डिंग स्क्रीनिंग शुरू करते हैं।
Leprosy is a disease of the skin and nerves. When I meet the community members, I use a flashcard to show them the different presentations of leprosy. With a flashcard and education material which has pictures, it is easy to explain to the people what leprosy looks like. One by one, I examine each of the persons for any signs or symptoms of leprosy.
महिला वॉलंटियर महिलाओं को स्क्रीनिंग करती हैं और पुरुष वॉलंटियर पुरुषों की स्क्रीनिंग करते हैं। निरीक्षण के समय अगर कोई संदिग्ध व्यक्ति मिलता है तो उसकी डिटेल नोट करते हैं और डिस्पेंसरी में मेडिकल ऑफिसर के पास जांच के लिए भेजते हैं।
Women examine, the women field workers, they examine the ladies of the family and the girls, and the male volunteer, the male health worker examines the male persons in the family. The names of the suspects are noted down and referred to the nearest dispensary for treatment. I have to keep all the records of the people that I have examined.
एक व्यक्ति को चेक करने के बाद सैनिटाइजर का प्रयोग करते हैं और अगर कोई कोविड सस्पेक्ट मिलता है तो उसे टेस्ट कराने की एडवाइस देते हैं और होम आइसोलेशन में रहने की सलाह देते हैं।
Whenever I examine a person, after that I use the sanitizer and then only I examine the next member of the family. If during my screening activity I come across any persons with signs and symptoms of COVID, I refer them to the hospital for examination and explain to them how to practice home isolation.
Then revisit के लिए नोट करते हैं। इलाज देर से शुरू करने या इलाज पूरा ना करने की स्थिति में व्यक्ति के अंगों में विकलांगता भी हो सकती है और उनकी परेशानियां बढ़ सकती हैं। इसलिए हम कोविड महामारी के दौरान भी कोविड की सभी सावधानियों को ध्यान में रखते हुए हाउस टू हाउस लेप्रोसी स्क्रीनिंग करते हैं।
लेप्रोसी की स्क्रीनिंग leprosy screening is continued even during the pandemic because it is very important to detect the cases early to prevent the development of disabilities. So during the COVID pandemic, the search activity is ongoing.
यदि जांच के दौरान डॉक्टर रोग की पुष्टि करते हैं तो हम रोगी का उपचार जल्द से जल्द शुरू कराते हैं। इसका एमडीटी के द्वारा पूर्ण इलाज संभव है, यह बताते हैं।
Whenever leprosy is confirmed in a suspect, MDT drug is provided to the patient and the patient is explained that MDT drugs cure leprosy.
हम सुनिश्चित करते हैं कि रोगी नियमित रूप से उपचार ले रहा है या नहीं। महीने में एक बार होम विजिट करते हैं। कई बार अगर रोगी की साइड कुछ हमें घर के पास कुछ काम होता है तब भी हम बीच-बीच में भी उसकी विजिट करते हैं और वह दवाई पूर्ण तरीके से ले रहा है कि नहीं ये चेक करते हैं।
When a patient is under treatment for leprosy, I visit the patient regularly, and whenever I am going near the patient's house for any other work, even then I visit the patient and ensure that the patient is taking drugs regularly. This is done so that the patient completes the treatment in time.
दवाइयाँ इलाज शुरू होने के बाद उसको कोई रिएक्शन तो नहीं है या उसके बॉडी पे कोई नए दाने या कोई रैशेस, नए पैच, लाल दाग या जलन, दर्द से भरे दाग तो नहीं है, उसको भी हम चेक करते हैं और अगर ऐसी कोई प्रतिक्रिया मिलती है तो हम उसको दोबारा से डॉक्टर के पास रेफर करते हैं और हॉस्पिटल भी भेजते हैं।
If the patient under treatment complains of any other complications such as rashes on the skin or any nodules on the body, then I refer the patient back to the hospital for further treatment and management of the complications.
अगर किसी रोगी में विकलांगता या सुन्नपन मिलता है तो हम उसे सेल्फ केयर के बारे में बताते हैं कि रोगी किसी गर्म वस्तु को पकड़ते समय कपड़े का प्रयोग करे या हाथ पैरों में को पानी में भिगोए और उन पर ऑइलमेंट करके रखे। गर्मी से बचें, घाव को साबुन और पानी से साफ करें।
Any patients with disabilities, I teach them about self-care, how they should protect their body from any further damage, how they must practice self-care. They should protect their insensitive hands and feet and soak them in water to keep them from developing any ulcers. The care of wounds is also explained to the patient.
हम रोगी को बताते हैं कि नियमित तौर पर इलाज कराने से आप जल्दी ठीक हो जाएंगे और आपको कोई विकलांगता नहीं होगी और घर की बाकी सदस्यों को भी यह बीमारी नहीं होगी। हम बताते हैं कुष्ठ रोग छूने से नहीं फैलता।
Regular treatment of leprosy with MDT drugs cures the patient of leprosy. Patients under treatment do not spread the disease. Leprosy does not spread by touch.
अगर किसी व्यक्ति के शरीर पर 1 से 5 दाग होते हैं तो 6 मंथ का इलाज चलता है और 6 से ज्यादा होते हैं तो 12 महीने तक भी इलाज चलता है एमबी केस में और 1 से 5 पीवी केस में।
Leprosy is treated in 6 to 12 months depending upon the number of patches on the body.
अब मैं आपको अपना एक सर्वे के दौरान एक एक्सपीरियंस जो मैंने गेन किया वो शेयर करना चाहूंगी। मैं आपको बताना चाहूंगी कि जब हम सर्वे कर रहे थे तो हमारे साथ एक जो एक्सपीरियंस हुआ वो क्या था। एक सर्वे के दौरान एक घर में हम लोग सर्वे कर रहे थे। सर्वे करते हुए हमने उनको लेप्रोसी और कोविड के बारे में सब कुछ बताया। उसके बाद उनकी पेशेंट की केस हिस्ट्री ली और केस हिस्ट्री लेने के बाद हमने स्क्रीनिंग करना शुरू किया। सर्वे स्क्रीनिंग करने के बाद भी 1 by 1 सैनिटाइजर का यूज करते हुए हमने सभी की स्क्रीनिंग करी और सबको अवेयरनेस किया। पर पूरा कंप्लीट सर्वे करने के बाद जब हम नेक्स्ट हाउस पे सर्वे के लिए गए तो उन्होंने हमें अपना हाउस सर्वे करने के लिए मना कर दिया।
She is explaining about one of her experiences. She's saying that I went to a house for examining the patient, and after examining every patient, I had to sanitize my hands. And
मना कर दिया क्योंकि मैंने उनसे पूछा कि आप क्यों मना कर रहे हैं, तो उन्होंने बताया कि आप जिस घर से सर्वे करके आ रहे हैं उस घर में कोविड पेशेंट है। मैंने उन्हें बताया कि अभी हमने सर्वे किया है और उनसे पूछा है, लेकिन ऐसा उन्होंने तो हमें नहीं बताया।
I was examining the members of a family, and they refused to be examined, and they told me that I had just visited a household where there was a COVID patient, and that is why they are afraid to be examined by her.
उन्होंने बताया कि आप जिस घर से सर्वे करके आए हैं वहाँ कोविड पेशेंट है। कल ही वहाँ पे आइसोलेशन की टीम आई थी जिन्होंने उनको आइसोलेट किया है, इस वजह से हम अभी सर्वे नहीं करा सकते। तभी हमने अपना सर्वे बंद किया और घर जाकर नहा के अपने आप को क्लीन किया। कई बार जब हम सर्वे में होते हैं तो हमारे पास ऐसी स्थिति आती है कि उन्होंने टेस्ट नहीं कराया होता, वो मे बी पॉजिटिव हो सकते हैं पर वो अपनी बातों को बताते नहीं हैं और हमें बहुत सावधानी से ये काम करना पड़ता है। इसीलिए इस काम को करने में बहुत समय लगता है और घर पे जब हम जाते हैं तो हमारे घर पे जो बच्चे होते हैं वो हमसे मिलने की कोशिश करते हैं। बहुत ज्यादा टाइम हो जाता है लेकिन हम उनसे मिल नहीं पाते क्योंकि हमें डर लगता है कि कहीं वो पॉजिटिव ना हो जाए या हमारी फैमिली पॉजिटिव ना हो जाए या हमारे कंटिन्यू सर्वे रखने से बाकी एरिया पॉजिटिव ना हो जाए।
When I went to a household, the people refused to be examined by me because I had visited a household before visiting their house where there was a patient of COVID, and the isolation team had visited the house. In such conditions, it is very difficult to examine patients, a very big challenge. And in this case, I had to go back home, sanitize myself, and then return for the active search. The same problem I face when I return from work to my home, when I cannot touch my children, as I do not want them to be infected by me.
ऐसी सिचुएशन में जब हम कोविड पेशेंटों को होम आइसोलेशन कर सकते हैं, कोविड के दौरान रेड जोन का सर्वे कर सकते हैं, कॉन्टैक्ट ट्रेसिंग कर सकते हैं, तो हम कोविड महामारी के दौरान लेप्रोसी को भी कवर कर सकते हैं। डिफिकल्टीज तो हमारी बढ़ गई हैं, लेकिन हम कोशिश करेंगे कि आगे हमारे देश में लेप्रोसी ना बढ़े और लोगों में जागरूकता बनी रहे और लोगों में विकलांगता ना बने।
I have continued to work for leprosy even during the COVID, and I hope that we will be able to work very hard to make India leprosy free, even with the challenges of COVID. If I could do it, I can do it at any other time. Thank you.
Welcome. Thank you for giving me this opportunity, and thank you all of you.
Thank you so much for your presentation.
Yes.
Next, we would like to invite Dr. Anil Kumar, Deputy Director General, Leprosy, Ministry of Health and Family Welfare, India. Dr. Kumar, we would like to extend you warm welcome.
Thank you so much, and good afternoon to all the participants, all the viewers. I would like to share my presentation. I hope I'm still not able to share it. I want to share my presentation and it is probably off. Can I share my presentation?
Dr. Nekoma, yes, we can see your presentation.
No, this is from my side, is it?
Oh, you want to, okay, you want to, okay. Okay, hold on,
I'm
please.
not able to move it. I don't think it.
Hold on, please.
Yeah.
Now you can show presentation by yourself.
Okay. So I'll just share and are you all able to see my presentation now?
Yes.
Okay. Thank you very much. I will be presenting, and I was hearing Anju Sharma, and she was explaining beautifully her experience. No, in fact, whatever I'm going to present, ultimately it is implemented through our grassroots level worker like Anju Sharma. And I would like to thank to her for her contribution under National Leprosy Eradication Program, and also lakhs of millions of workers which we have all over the country, the ASHA workers, the MPWs, and the other supporting staff who are implementing the activities under National Leprosy Eradication Program. Now this is this you can see, this is a epi curve, the curve of the pandemic COVID-19, and as you can see there are three waves: first one, second one, and third one. Now, for first one, as you can see, we started having the cases early in the March 2020, and then we had a lockdown in the country with effect from 25th March, which continued till 30th May, and after that we relaxed the lockdown. Why I'm presenting this graph to you, that it was really a difficult scenario to implement the activities under National Leprosy Eradication Program. And during second wave also, and now also, there is some, difficulty which we are facing to effectively implement activities under National Leprosy Eradication Program. And under those circumstances, we really worked hard to take the services at grassroots level. So this is, I just wanted to show you the impact which we had. As you can see, after 2005, when we achieved elimination, the national annual new case detection rate and the prevalence rate was almost static. And in 2015-16, as you can see in the graph, as you can see, the slight increase in annual new case detection rate also, and prevalence also during that time. It was due to various, intervention which we started, like leprosy case detection campaign, and later we started the first leprosy awareness campaign, and many other initiatives we took during that point of time. And because of which you can see the increase in annual new case detection rate. But after that, after we started all these early case detection activities, our prevalence rate and also annual new case detection rate continue to went down, continue to go down. So that is the scenario. And as you can see, in 2021, there is decline is furthermore decline. As you can see, there is decline is much more as expected. And this is not the actual decline. This is probably the decline due to the cases which we were expecting to detect, we could not detect. So some of the cases could not be detected due to COVID pandemic. So although we worked very hard to detect all the cases, there was some impact of COVID-19 pandemic. And as you can see in the box above, on 31st March 2020, we had some 80,000 cases under treatment, and on 31st March, cases went down to 57,672, which now, recovering, and on 30th November 21, so around 60,000 cases were under treatment. So things are improving slowly and slowly. Again, if we look at the G2D cases per million population, cases, continue to go down after leprosy case detection campaigns and other intervention which we started. And in 2021, again, there is decline, but this decline is more than expected. And if you carefully look at the graph, this decline is more than expected, and probably this decline is also due to reduction in detection of cases. But this is not such a clear or steep decline as we have seen in case of cases, the ANCDR and prevalence. Similarly, if you look at the percentage, now percentage of grade 2 disability among new cases is an indicator which tells us whether case detection activities are going, are being implemented very effectively at a grassroots level. And as you can see that in 2021, there is no decrease as expected as per the trend which we had earlier. So this is something we have to think about, because we need to further improve case detection activity at grassroots level. So if you look at all those graphs which I presented, you can see that there is some impact of COVID-19 pandemic on case detection activity, and how we could achieve that. I mean, despite of all those that pandemic, how we could restrict the graph to not going to such a bad level. It was because of a series of actions taken by Ministry of Health and Family Welfare, Government of India, to detect cases. Now, first one is, as you can see, we had around 80,000 cases on 31st March of 2020 when pandemic started. Now, after that, we issued guidelines that, and we said we clearly send message that this leprosy services, this is also essential health services, and we have to continue to provide services under this program even during pandemic. That was a clear instruction sent to states and to the grassroots level workers all over the country. And MDT was, we ensured that each and every person who is having, who is a known case of leprosy, he is getting, MDT timely and as per requirement. Similarly, reaction cases, whatever drug is required for reaction cases, that we also ensured, and we ensured it through, our system. We were connected through, virtual mode. Our people, when going for other purposes also, because many of the leprosy officers, the state leprosy officer, district leprosy officer, they were involved in COVID-19 pandemic control activities. So whenever they were going in the field, they were ensuring that all these services are provided to the cases. And that is why teleconsultation and counseling service through virtual mode, we were reaching to the people, to the cases in the country. And similarly, the surveillance activities. Now, surveillance activities in India, we had containment zone, we had buffer zone, where COVID-19 control activities were going on. But beyond buffer zone and the containment zone. We were, continuing our case detection activities as usual. Of course, during during that particular period of time in containment zone, we could not continue the case detection activities, and that is why case detection was a little bit lower. Similarly, other activities, what we did, that whenever our grassroots worker, they may be leprosy worker or other workers, whenever they are going for COVID-19 related activities, so we instructed them that you have to look for the leprosy cases also. So through this way, to some limited extent, we could continue our activity in containment zone and buffer zone also during COVID pandemic. Similarly, post-exposure prophylaxis, which is given to the contacts of the leprosy cases, that was also continued throughout the country. And all people who were requiring post-exposure prophylaxis, the rifampicin was given to them as per protocol. Now there was another issue related to migrant population. They were moving from one place to another place. Now they were under treatment at one place of time. Say for example, many of the these migrant laborers, they were under treatment in Delhi and in Punjab. These are the area where they moved from UP and Bihar. So they all went back, and that is something which was where it was difficult to continue to provide the services. So all the data related to treatment was shared with the UP and the Bihar state leprosy officer, from where these migrant laborers were coming, and other states also. I am just giving an example of these two states. And then they were traced, and the MDT was provided. And for this purpose, we, to find out the defaulters, we developed the WhatsApp group, Leprosy Action Group we called it, through which we were connected to all of them, and we ensured that each and every person who was under treatment should get the MDT on time. So this is supportive supervision was provided at all level, national level, and also national level, state level, district level, so that people continue to work. And when I'm talking about all these activities, I must mention that our association of persons affected by leprosy, the APAL, and other NGOs, our ILAB partners, and other NGOs working in India, they all supported during this period of time, not only supporting the National Leprosy Eradication Program in various activities, but also they provided masks to these people, and other sometimes food material was provided by them. So all over the country, although during COVID-19 we were working separately, but also we were in coordination to support leprosy cases and to support the leprosy case detection, and also leprosy affected persons were supported in different manners. And this is something which was really great. So this is again I'm presenting this graph of pandemic. We get a window period somewhere December 20 to February, January, February 21. So this is the time when we could further accelerate our activities related to leprosy control, prevention and control. And this is the time when we conducted our Sparsh Leprosy Awareness Campaign. Now this Sparsh Leprosy Awareness Campaign is one of the best practices which India is having, and which other countries also can copy. With this is an example how with limited resources we can educate, we can have IC activities throughout the country. In India we have some 600,000 villages. This particular activities was conducted, our target was to conduct this activity in all those 600,000 villages all over the country, where village leader, the panchayat, we have the panchayat system. The village leader, he conducted a meeting at village level where school teachers, the person affected by leprosy, and other people, they are the resource person, and the general community at the village level, the villagers, village peoples, they are there. They are member of the village panchayat. So they are present there, and then the message about leprosy is given. There are different messages, and we target particular message during this period of time. We targeted a particular message during for Spread Leprosy Awareness campaign, and we felicitate the leprosy affected person so that we give a good message to the community at village level, that we have to accept all leprosy affected person in the society, and they are our brother, and we have to give them have a good behavior towards them. So these are the messages, and these are the message related to early detection of cases. Very effective messages are these are very effective messages, and this is why we could, even after pandemic, we could detect quite a large number of cases. Otherwise, that could have been difficult for us to take our program forward. So this is something a unique thing which we did, and we find the right time between the two waves of COVID pandemic. So this activity was conducted, and this helped us in taking the message to the community and detecting more cases. That was an opportunity to detect more and more cases. So and all these activities were coordinated by our district leprosy officers and our consultants working, NLP consultants and others working in the field. So these are some of the photographs of Spread Leprosy Awareness Campaign 2021. As you can see, they are all working in the field, and they are all following the COVID protocol. They are all having masks with them. So with this, what I wanted to present, that we, the Government of India, the Ministry of Health and Family Welfare, we took, we had proactive approach. We did whatever we could do. Our people, state leprosy, district leprosy, all, NGOs, APAL, they all, helped us in detecting more and more cases. Now, what is the way forward? We expect that this pandemic will be over very soon, and now there must be a backlog of leprosy case detection cases in the community. Actually, the early cases, mostly the early cases for 20 and 21, and we have to again start some sort of campaign like leprosy case detection campaign, which we conduct to detect all that backlog, so that we can take our program in the direction to approach leprosy-free India. Now, leprosy-free India is no more a dream which is very far. We can see now that we can just raise our head, and we can see it is reachable now. It is within our reach. In time-bound manner, we can reach there. So leprosy-free India is not that far. In time-bound manner, we will achieve that leprosy-free India, and that is not very far. And we have a plan of action. We have already prepared a plan of action to achieve leprosy-free India, which we will unveil very soon in 1 or 2 months. And once this pandemic is over, we will, with full pace, we will be racing toward achieving leprosy-free India. And once we achieve leprosy-free India, it will not be long time when we will be achieving leprosy-free world. So with this, thank you very much for giving me opportunity to present. Thanks.
Thank you so much, Dr. Anil Kumar, for your presentation. Now we would like to move on to the next session, which is disability and also care in Nepal amid the COVID pandemic. First, we would like to invite Dr. Indra Rapid. He is a senior orthopedic surgeon at Anandaban Hospital, which is run by the Leprosy Mission Nepal. Dr. Indra, we would like to invite you to give a presentation now.
Thank you very much. Hello, everyone. I'm Dr. Indra Napit from Anandaban Hospital, the Leprosy Mission Nepal. I'm talking about good practice on disability and also care in Nepal amid the COVID pandemic. Anandaban Hospital is one of the tertiary leprosy referral hospital in the management of leprosy in Nepal, and patients are referred from all over the country for complication management, mainly for leprosy diagnosis, along with confirmation of leprosy relapse, reaction management, ulcer management, reconstructive surgery for deformity correction, clinical research projects, etc. And we have leprosy, 80 beds for leprosy out of 110. Next, please. Next slide, please.
Okay, it takes time a little bit, so could you please wait? Okay.
So PCR has been doing at Anandaban Hospital since a long time for confirmation of leprosy. And during now COVID pandemic, we have been also using this for COVID diagnosis. So during this COVID pandemic until 31st December, we have performed more than 7,000 tests with PCR and antigen with almost 22% positivity. And also all the leprosy patients who are admitted at Anandaban Hospital and also who come for other procedures, they are also tested. And we found 566 patients are positive with PCR and antigen tests for COVID, which is almost 37% positivity. Next one, please. So during this pandemic, we have admitted 54 leprosy patients at Anandaban Hospital with free of cost. And recently now even we have already 3 leprosy affected people admitted with COVID at Anandaban Hospital. Leprosy Mission Nepal is running Anandaban Hospital with 3 satellite clinics for leprosy services. One in Kathmandu Valley with weekly clinic, and 2 out of Kathmandu, one in east and one in west of Nepal. All clinical services were continued during COVID-19 pandemic at Anandaban Hospital, but the satellite clinics were closed for some time during the national lockdown period. And that was basically because of the travel restriction. As you see on this picture, this table, for last 10 years, there's comparison of surgeries, reconstructive surgery and septic surgery we perform at Anandaban Hospital. And in 2020, because of pandemic, the number of surgeries are reduced. But in 2021, we have been able to pick it up again. Disability prevention is one of the major challenges in leprosy management, and we all know that we should focus on early diagnosis and management of neuritis, also early nerve decompression for neuritis and nerve abscesses. And once the disability deformity is developed, so we go for reconstructive surgery, and basically we do for correction of hands, deformities in hands, feet, and eyes in leprosy. So this is one picture of claw hand before and after surgery. Next one, please. I want to explain about this new technique of doing surgery. It's not a surgical technique, but 2 surgeries doing at one step. We call it 2-in-1 surgery, which we started at Anandaban Hospital in 2012. So we do 2 surgeries, one for last thumbs and one for other 4 surgeries. Usually these 2 surgeries are done separate, but now at Anandaban we are doing, if patient have both ulnar and median nerve palsy, we do all 5 fingers at one step, which is a lasso and opponentsplasty. So it's like 2-in-1 surgery, and this has reduced the duration of hospital stay, and also we have found good outcome from this new technique. Talking about ulcer care at Anandban Hospital, every year more than 300 patients are admitted with foot ulcers, with referrals from other hospitals for complicated ulcers. And right now we have a RIGHT project, which is Research and Innovation for Global Health Transformation, performing randomized clinical study, which is called TABLE study. And the TABLE means trial of autologous blood products to promote ulcer healing in leprosy. And this is funded by NIHR UK and sponsored by University of Birmingham. Next one, please. And we have got ethical approval from Nepal Health Research Council on 3rd September 2020. And this trial is going on at Anandban Hospital. And during first lockdown, we didn't have many leprosy patients coming to Anandban Hospital because of the travel restriction. And also many patients had felt fear of COVID transmission. But after the vaccination was started by Nepal government, then in 2021, the patients number, visit number has gone up. And we also have provided vaccines to all our leprosy patients who were admitted at Anandban Hospital and also through our satellite clinics. As a mitigation plan, so we decided to have more visits out of Kathmandu Valley so that we could collect more patients to bring to Anandban Hospital for treatment. So we visited government hospitals, leprosy hospitals in different places in Nepal, and also our weekly and monthly satellite clinics where we did screening for deformities, cases, and foot ulcers. Next one, please. So because of this effort, we have been able to, sorry for this picture, wrong position. During lockdown, we arranged hospital vehicles, ambulances, transportation of leprosy patients to come to Anandban Hospital and also go back because the local transportation was not available during travel restriction. Next one, please. And sometimes we reserved a vehicle so that many patients could come directly to Anandban Hospital. And home visits for follow-ups has been also a challenge for us. Patients could not come to Anandban Hospital due to travel restriction. So we had more home visits and had to walk sometimes for 3 to 5 hours as roads were damaged by heavy rains and landslide during monsoon. Next one, please. During follow-up, so we see sometimes like this where lack of self-care is present. So the ulcer was healed and sent home, but still because of lack of self-care, patient have heart callus. So we could teach about self-care at home itself. Next one. I want to talk a bit more about innovative technique in ulcer treatment that we are performing at Anandban Hospital, which is called LPRF dressing. We started this at in January 2018. LPRF is leukocyte and platelet-rich fibrin. So it's we prepare this from blood, patient's own blood, and this accelerates the healing of ulcers. And I want to show you, next slide, please. I want to show you how this LPRF dressing is done. Traditionally, the dressing change is done every day, but with this LPRF dressing, we do it only once or twice a week, and no need for daily dressing with LPRF treatment. Then we apply Vaseline gauze and then simple bandaging. And the same procedure of application of LPRF matrix is done weekly or twice a week until the ulcer heals. Next one. So this project is going on at Anandban Hospital right now, and we collect venous blood from patient in tubes and then run into centrifuge for about 12 minutes. And then we get the gel like this on the right side. Next one, please. So after centrifuge, the white blood cell with platelets will be on the top, the white part. So we take this out from that tube and discard the red cells from the bottom. Next one. So that white gel is now compressed for 2 minutes to make it flat so that we can apply over the ulcer. So then we bandage it. Next one. So this procedure is simple. So even paramedics and nurses also can perform this. So this is one of the example that ulcer was not healing even at Anandban Hospital, staying for more than 6 months. And after 7 applications of this LPRF dressing, this ulcer was healed with very nice complete epithelialization. Next one. This young man had undiagnosed leprosy and he didn't feel bone injury due to loss of sensation in his leg. He was diagnosed of leprosy after this bone injury. He had exposed patellar tendon, as you can see the white part at knee joint, which was not healing. So later with this LPR application, this also wound was also healed. And then he was also treated for leprosy. Next one, please. So under this table style study, we aim to evaluate the efficacy of this LPRF dressing in healing of leprosy ulcers. And this is single center randomized controlled trial. And the participants with foot ulcers in the range of 2 to 20 square centimeters ulcer size will be enrolled. And we plan for 130 participants, 65 in each arm, control and intervention. And the main outcome will be looking at rate of healing and time to complete the epithelialization within 70 days. Next one, sir. So until 31st December, we have been able to screen 223 patients and 126 were not eligible because of different reasons and exclusion criteria. And we have now enrolled 97 patients and 18 patients are still under treatment at Anandban Hospital now. So after we complete this study, so we are planning to disseminate our result, and also we will train staffs in other hospitals in Nepal and overseas to start this innovative technique, and we hope for the transformation of life in leprosy affected people. Thank you very much.
Thank you so much, Dr. Indra. Thank you so much for your presentation.
Thank you.
ラビットさん、質問が一つあるんですが、よろしいでしょうか。素晴らしい技術を拝見させていただきまして、大変驚くとともに素晴らしい技術に感銘を受けました。私もたびたび先生の病院を訪問したことがありますが、私が訪問した時には割とリアクションの患者さんが多かったのが気になってるんですが、現在はリアクションの患者さんというのはどうでしょうか。やはり相当数いらっしゃいますか。
Yes, yeah, that's true. We still have reaction patients at Anandban Hospital. And for reaction management, also we have now new drug trial going on at Anandban Hospital. And we have already completed first stage. So now we will start very soon second stage of that trial with new drug. And we have seen that trial has given very good effectiveness to manage the ANL reaction, mainly type 2 reaction.
ありがとうございました。
Thank you very much.
Thank you so much. The next speaker is Dr. Ravindra Baskota, Director, Leprosy Control and Disability Management Section, Ministry of Health and Population, Nepal. Dr. Baskota, very warm welcome.
Hi everyone, my name is Ravindra Baskota and I'm working as the Chief of Leprosy Control and Disability Management Section under Ministry of Health and Population of Nepal. I'm going to share the experiences of National Leprosy Program on disability and also care in Nepal during the COVID-19 pandemic. Next slide, please. This is the map of Nepal. We have 77 districts, and on mapping the districts on G2D among new cases in the last fiscal year, there are 25 districts where we got grade 1 and grade 2 disabilities. These are the districts marked with red. And in 22 districts, we found cases with grade 1 disability only, those districts marked with yellow, and 30 districts did not report any cases with disabilities. However, we could not map districts on the basis of ulcer presentation. This is because we do not have the exact data on ulcer, as there is no system of reporting of ulcers in the HMIS reporting platform, which we are using. There were more than 140 new cases with grade 2 disabilities. These accounts nearly 6.5% in proportion, and the G2D rate was nearly 4. And there were 6 new cases of child with grade 2 disabilities. The surge of COVID-19 infection and subsequent lockdown resulted in closure of many public and private health facilities, including those providing leprosy services. Many persons affected by leprosy could not continue to access services from the routine health facilities. And those who were impacted more were cases of leprosy with grade 2 disabilities and those with ulcers. Most health facilities, health workers, and financial resources were diverted to COVID response, and many health programs, including the activities of National Leprosy Program, was compromised. Next slide, please. The country was in lockdown from March 2020, so all field activities were cancelled and we operated from work from home. But we took this an opportunity to develop national guidelines on leprosy, disability, and rehabilitation in relation to the COVID-19. We developed and endorsed 3 interim guidelines that included a guideline on delivery of leprosy services during COVID-19 pandemic. This guideline was focused on persons affected by leprosy, guideline on delivery of health services in COVID-19 pandemic, focusing to the persons with disabilities, and interim guideline for health-related rehabilitation and physiotherapy in acute care settings, focusing on the persons with COVID-19 infection. And along with this, we did development of inclusive COVID-19 IEC materials as well. Next slide, please. However, with the ease of lockdown and taking COVID-19 safety measures, we resumed various leprosy, disability, and also care activities amid the pandemic. This included continued supply of multi-drug therapy. We provided home delivery of leprosy medicines and medicines for reaction management. And some of the good practices which we conducted in the country were almost similar to those conducted in our neighboring country, India, as shared by Dr. Anil Kumar in his presentation. And those activities included tele-counseling and tele-consultations through mobile and other social media, diagnosis and treatment of new leprosy cases with G2D. This was continued even during the pandemic. We did management of neuritis, management of ulcers, also specific surgeries were done as shared by Dr. Indra Napit in his presentation. We also did home visits and we supply footwear and orthosis appliances. We also provided education on self-care and conducted a few reconstructive surgeries as well. But these activities were conducted in limited capacity. Next slide, please. We have few leprosy dedicated hospitals in the country. For example, we have Anandaban Hospital, we have Lalgarh Hospital, and we have Green Pasture Hospital. And this is the data from Lalgarh Hospital in the year 2020, showing activities carried out as prevention of disabilities and also program. And this hospital conducted 75 POD clinic visits and 10 reconstructive surgeries were done. Similarly, 113 patients received septic surgery. 945 patient visits were there for reaction and neuritis management. 1,732 patient visits for ulcer care. 1,534 clients, they received protective footwear, 37 clients received orthosis, and 26 clients received prosthesis. So here we can see that if you compare the target versus achievement, this was there was no significant achievement in respect to the target, but still we managed to do some of the routine services to be provided for the also care and disability management. And we conducted series of virtual meetings with stakeholders for development and finalization of the national policies and guidelines. I'm talking more in relation to making up the guidelines, because I'm working as a national program manager. So most of the activities were focused on making the guidelines on disability and also management. Next slide, please. IEC materials on leprosy and COVID-19 were developed, and they were disseminated at local context. For example, the message written in this paper says that we should fight against COVID-19 as well as leprosy with respect and dignity. Such messages were posted on the walls of community houses by self-help groups. Next slide, please. Patient examination, early identification and management of reactions, disability prevention, and also care services were also carried out during the pandemic period, which reflects that we have not forgotten leprosy even during the pandemic. Next slide. I would like to thank all of you for your time and attention, and many thanks to Sasakawa Health Foundation for giving me this.
ありがとうございました。素晴らしいご説明をいただいてありがとうございます。一つ質問でございますが、特にネパールにおきまして、タライ地区と申しましょうか、インドのビハールやUP と接する地域においては、比較的患者さんも多くいらっしゃるようでございましたけども、病院の施設も大変素晴らしいですし、またインドのアッシャーさんとはシステムが違うようでございますが、家庭訪問をして積極的に患者探しをなさっている女性のグループとお話をする機会がありましたけども、大変モチベーションが高くてですね、自分の仕事を誇りを持ってなさっている女性たちにあって、大変心強い素晴らしい良い印象を受けたことを経験しております。ありがとうございました。
Thank you very much, Mr. Sasakawa, for your nice words and for your comments and feedback. Thank you.
Thank you so much, Dr. Rabindra, for your presentation. Now we would like to have comments from a representative from persons who have experience with leprosy and a medical expert. First, we would like to invite Mr. Dinesh Basnet, President of India Nepal. Mr. Basnet, very welcome. The floor is yours.
Thank you. Distinguished guests, ladies and gentlemen, good morning. Good morning, good afternoon, good evening. Greetings to you all from Nepal. First of all, I would like to thank the organizer, Sasakawa Health Foundation, for hosting such a great webinar. As a person having experience of Hansen's disease or leprosy, I feel honored to have this role of commentator at this great webinar. I thank all the presenters for your involvement, input, and information. I am personally very happy to see the progress made in recent years. I thank you, the Health Ministry, Virod Khatiwada of Nepal for tracking the history of leprosy status in Nepal and for the efforts Nepal government has been carried out for so long in the elimination of the disease. I hope with the elimination of the disease, the consequence related to the disease will also come to an end soon. I will also like to remark on the alternative way to intervene the needy even during the pandemic caused by COVID-19. It was a huge challenges, and despite the challenge, the intervention was not halted. This has been possible because of the sincerity of Nepal government and the sincerity of Nepal government and the dedicated staff members. I thank you again, the Nepal government and the staff of your continued support even of such difficulties. And I am pleased by the presentation of Dr. Anil Kumar, Deputy Director General Leprosy India. Know that there is down trade in the annual cases detection in India. However, I have concern how effective case detection could happen during past 2 years where country is hard by COVID-19. It is very much good to know that India is able to manage uninterrupted supply of MDT to all on treatment leprosy patients during lockdown. And I also come to know that there are active groups even by WhatsApp or other means of communication so that they can share their issue and can support each other even in the pandemic situation. Similarly, thanks to Anju Sharma, she also worked hardly in this situation. And I would like to thank Dr. Rabindra Baskota and his efforts for the management of leprosy cases, alternative and adaptive way for the purpose during the lockdown, like counseling, consultation, and education on self-care of wounds, also supporting the health center, etc. Surely this benefit many more people affected by leprosy. I am very much impressive from the presentation of Dr. Indra Napit. I can say the revolutionary innovative way of treatment of ulcer. It is kind of blessing we are feeling because we have number of example of unhealed ulcer since long time where health because of this LPRF intervention. We will be happy if there are more satellite clinic in the country that the existing ones, Patan Clinic, Biratnagar and Butol. It also noted the involvement of Dr. Indra's contribution in the policy making and awareness raising. His expertise really benefit in review and planning. In overall, personally, I am happy for the work that has been done so far as of now. Gradually, the community in sensitize us and stigma in being reduced through. There are a lot of work to be done. Maybe it is the sector of active yearly case detection, treatment, and rehabilitation, empowerment, and livelihood. So that everyone has high level of self-respect and for the integration in the community. I would like to thank all for bottom of my heart, myself, and on behalf of people affected by Hansen disease for the detection work done towards the zero transmission, zero disability, and zero discrimination. We are together in the journey, and we trust with such our goal soon. Hope next generation live without any experience of Hansen disease in them. Again, despite gratitude to Sasakawa Health Foundation for their tireless effort and contribution in eradication leprosy and enhancing the dignity of people who have experienced Hansen disease around the world. As a lived experience of leprosy, I must admit because of your continuous great effort globally, may our brothers and sisters who have experienced Hansen disease would like dignified life, but yet we have to go long to reach our destination, which means no discrimination, no disability, and no transmission. Thank you for all kind your attention.
Thank you so much, Mr. Dinesh. Thank you so much for your comment. Next, we would like to welcome Dr. Lao Pemalaj. He is an active team leader, WHO Global Leprosy Program. Dr. Lao, it's a pleasure to have you on the floor now.
Thank you, Kiyomi-san. Can you hear me?
Yes, I can hear you.
Thank you, Kiyomi-san, for inviting me to be part of this important webinar. Good morning, good afternoon, good evening, colleagues from different parts of the world. Very happy to be part of this interaction, listening to the health workers. This being a series of Don't Forget Leprosy campaign, discussing the role of health workers is a very important and relevant topic. It was a great learning opportunity, in fact, to listen to the experiences of the national program managers, frontline health workers, and also my brother Dinesh, to see how we are going to take forward the leprosy program in the COVID situation. Thank you, Honorable Minister of Health and Population Nepal, for expressing the political commitment. It's very encouraging. I think this is something which we need to replicate in other countries also. Thank you so much. Thank you, Your Excellency, Mr. Yohei Sasakawa, WHO Goodwill Ambassador for Elimination, for spearheading this Don't Forget Leprosy campaigns. Very relevant indeed. From WHO, we subscribe to this campaign. I bring greetings from Dr. Poonam Khetrapal Singh, Regional Director, WHO Southeast Asia region, who is head of the Global Leprosy Program. I must congratulate all the health workers worldwide, despite the population movement restrictions imposed due to the pandemic, and also because of many restrictions for patients' travel. New cases detection continue. We could get large number of cases were detected. And moreover, treatment was continued. And treatment was made available in spite of these difficulties and COVID situation. Mrs. Anju Sharma was mentioning her experience in this regard. Disabilities were prevented because of some cases detected, which could be an indicator and which we need to do more, but still it was a great work. Congratulations to all of you. It was very heartening to see that research is continuing. Congratulations, Dr. Napit, and also other colleagues in other regions, even in India, that there were very good research has been taken forward in wound care and in enabling surgery. These things need to be replicated in other areas, as Our Excellency, Mr. Yohei Sasakawa has mentioned. With regard to the role of health worker, I could see that informing about leprosy, the scientific facts, particularly to the family members, is the elementary step or a role that has been taken forward during this COVID situation. Counseling of a person affected by leprosy at diagnosis is as crucial as providing tablets or medicines to cure leprosy. And that was very well taken forward, as we could hear from the experiences. The presentations from Nepal and India have demonstrated all throughout that treatment was continued and treatment was ensured during this COVID-19 period also. Talking about the role of health worker, there is also something we could listen. Long treatment regimens may result in interruption. And this is here again, the health worker walks with the patient from diagnosis to cure, encouraging, counseling, and motivating, and ensure that adherence is achieved for the prescribed treatment regimens and supporting the patient when complications arose during the course of treatment. That's a really great role of hand-holding all through the journey of a person affected by leprosy. The presentations have clearly shown that there is a very balanced blend of empathy and expertise, and that led to the cure of the leprosy, person affected by leprosy. And also after curing the person, a care is provided to the person affected by leprosy. I agree with my brother Dinesh when he said that the presentations mentioned like digital solutions, telecounseling were very helpful. Yes, this is a very, very important innovation, and this can be continued and this can be a useful tool in other situations to come, particularly in certain challenging situations where health workers cannot move to the persons affected by leprosy and persons affected by leprosy cannot move to the health facilities. Several innovations we could see during the presentations: teleconsultation, and also reaching the people through the community and field activities, home visits, community-based satellite clinics. All these innovations are very, very, very helpful and also need to be replicated. We were very happy to see reconstructive surgeries were continued in Nepal. And similarly, we have information that reconstructive surgery has been continuing in other countries also. Reconstructive surgery enables people and also restores the smile. The slide Dr. Indra Napit has put was very, very impressive. The smile is very, very important to restore on a person affected by leprosy. Thank you, Dr. Indra. Thank you also for caring for the persons affected by leprosy when they suffered from COVID-19. That was a great job. And the presentations also indicated that services were continued all throughout in the COVID-19 situation. We cannot talk about role of health workers without talking about COVID-19. COVID-19 has affected all health programs. And again, it's health workers who sustain. Health workers, there are different segments. They start from very frontline health workers like community health volunteers in Nepal, our sister Anju, Asha, Anju, who has made presentation, to the specialist surgeons and specialist research scientists. They're all a different spectrum of health workers, and they have all done a lot of work to sustain health during the COVID-19 pandemic. COVID-19, look at person affected by leprosy, did not just affect health. It also affected socioeconomic situation of persons affected by leprosy. Several people became poor, and it also affected some of their jobs. It is at this point I thought I should mention it's important that efforts should be continued to restore health, economic status, and also support persons affected by leprosy in future livelihood options. This is our collective responsibility. All of us need to really work together as health workers and also as persons in the community, that we need to restore all these three to the persons affected by leprosy. I take this opportunity to appreciate the services provided by health staff in sustaining leprosy activities particularly, and also caring for COVID-19 for the persons affected by leprosy during the course of the disease, and extending services to the best possible way in the most challenging situations. Congratulations once again, and thank you, Your Excellency, Mr. Yohei Sasakawa, for spearheading this Don't Forget Leprosy campaign. All these presentations have clearly mentioned that they don't forget leprosy in spite of the challenging situation. Thank you very much.
Thank you very much, Dr. Rao. Thank you very much for your comment.
いただきましてありがとうございました。一つネパールの病院には多くのインドの患者の皆さん方が入院されておられます。ネパールにおきましては 国境を越えてきた患者さんに対しても、ネパールの人と同じように治療をしていただいているという姿をあちこちで拝見しております。大変私は人道的に素晴らしい対応をネパールではしてくださっているというふうに思っております。今日のこのウェビナーでの皆さん方の報告を聞きまして、実は私は、このコロナのパンデミックの中でですね、皆様方の活動が相当制約をされているのではないかというふうに勝手に思っておりましたが、こういう困難な中でもですね、特にフロントランナーでありますヘルスワーカーの皆様方が献身的にお働きになっているということの報告を受けまして、本当に感動をいたしております。やはり早期発見、早期治療のためには、やはりヘルスワーカーの方が各家庭を回って発見するというのが最も重要な私は作業だと思っております。そういう点で、フロントランナーでいらっしゃるヘルスワーカーの皆様方のお働きに心から敬意と感謝を申し上げたいとコメントさせていただきます。
Dr. Lau, you are unmuted, so you can speak.
Yeah, thank you very much, Yomi-san. Your Excellency, you're very right. There is some people from India cross into Nepal, and also similarly, some patients are also come to India. We have kept a very clear track of the numbers, and thanks to both national program managers who are in the panel, Dr. Rabindra Vaskota and Dr. Anil Kumar. We work very closely with them to ensure that they receive MDT. And we are really grateful to Lalgarh Hospital, where they provide excellent treatment for several complications, particularly. People try to reach them and get the expertise. We also see several patients coming over to Delhi and Patna, where patients come for taking treatment. And we are very grateful to the doctors in those regions to provide high specialized treatments to these patients. It is the expertise that attracts the patient. The borders are only drawn by us, but when they hear about an expert across the border, patients tend to move. Your Excellency, I also would like to submit another reason when we found discussing with these patients that some patients across the border villages, due to stigma of taking treatment in their same village, they go to the neighboring place and take treatment. So there are multiple reasons and we need to respect them. And I'm very happy to see that across the border, when the doctors and the treatment centers, they respect them. They respect the confidentiality and they provide complete treatment in spite of difficulties of sustaining stocks. Thank you very much, Your Excellency. We take note of this situation and we will continue to monitor and we'll continue to report to you all through. Thank you very much.
Thank you for your comment. Now it's time for us to move on to a panel discussion. We would like to invite a facilitator, Professor Takahiro Nandi. He is an executive director of Sasakawa Health Foundation. Also, we'd like to have three panelists, Mr. Yohei Sasakawa, Dr. Anil Kumar, and Dr. Rabindra Baskota on the floor. Professor Nandi, would you please take the role?
Thank you very much, Kiyomi. First of all, I would like to apologize to the audience because the time is already running out. We are supposed to finish this webinar at 8:30 in Japanese time. So I will try to ask one or two questions to each panelist and invite each of you to make a final remarks. So I hope you can stay with us a little bit longer. So the first three, Dr. Kamal and Dr. Ravindra, welcome back to the Leprosy community. I'm very glad to reconnect with both of you. And as you know, today's theme of the webinar is the role of community health worker or health professional at the grassroots level. So my question to you is that what could be done to enhance the work of the community health workers, and also what kind of additional support are needed for them? So maybe I want to invite Dr. Kumar at first.
Thank you very much. See, in India, our grassroots health worker, they are ASHA. And one of the support, which has been provided to them with the support of you only, your organization, that they have been provided flip chart. I think that is a very, very important tool which has been provided to them. We have empowered them. We have motivated them to work for leprosy elimination, leprosy, to make leprosy free country. Because, when they are having, they really feel, empowered that they have something. That tool always remind them that they have to work for leprosy. And when they go to the community, when they are, some 3-4 ladies, because the ASHA worker, they live in the community only. So whenever they feel they can, they want to explain, they have a tool, and using this tool, they can explain. So I think this is a great support which has been provided to ASHA workers in India. That is one thing. Other thing is, we need to probably, recognize what they are doing. We should be able to find out the way we can recognize them. Maybe at district level, some sort of token sort of gift, or, announcing them. See, in a village, when ASHA is being recognized, that is, really great. Gift may not be very expensive, but when we do that, that recognition is very, very important for them, because, the community, and not only that village, the other villages also, people will know that, this particular, ASHA has been recognized. And, others are also encouraged for that purpose. So I think we need to find out the way how we can recognize them. This is, something we will discuss, and we can have a discussion with you later. I think these are the two things. There are other aspects also, national level, because the ASHA scheme in India is incentive based scheme. So we are also making, work in leprosy more attractive, incentivized to them. So that we will be doing at our own level. But I think these two things, first of all, is already there. And one more we can think of about providing them some sort of recognition. Thank you.
Thank you very much, Dr. Kamal. I remember about the flip chart project. It was in 2018, when we have having a meetings. That was your suggestion. And fortunately, we have succeeded to distribute about 300,000 copies to ushers in some of the endemic states. So maybe I should lobby to Mr. Sasakawa to increase the budget, to increase the number of the flip chart. Thank you very much, Dr. Kumar. So Dr. Ravindra, please.
Yeah, I also totally agree with Dr. Anil Kumar in how we can enhance the community health workers to make them more dedicated in their work, in case identification, making screenings, and timely referral of the suspected cases for the treatment. And I totally agree, the incentive-based system and recognition will be a great support. But in addition to that, in context of Nepal, what we are facing is that according to the new system in the country, we have health workers in the community, but they are not being trained for a diagnosis of leprosy. They are not being trained for giving necessary treatment and making management of the reactions. So I think that because the senior health workers who used to be there in the system, who worked for a lot for the leprosy case management, now they are being retired, and the new ones, they have not received enough training to diagnose leprosy. So this training part should be enhanced in the Nepalese context. So if possible, if we can give a few days training or orientation to the community health workers in early diagnosis in the terms of reaction management, I think that will be very helpful in addition to what has been explained by Dr. Anil.
Thank you very much for raising the issues of training, Dr. Ravindra. I think that is another important issue. And as you know, since both the Nippon Foundation and Sasaka Health Foundations are closely working with WHO, and we are trying to support leprosy program in each country through WHO. So maybe this can be discussed among your government, the WHO country office in Nepal, and the foundation. So thank you very much. Okay, so I want to ask a different question to Mr. Sasakawa. I thank you very much for your comments after the presentations. But I want to ask you one thing. You have been actively working on the leprosy and human rights for the past 20 years or so. And my question to you is that what could be the roles of community health worker to eliminate stigma and discrimination against persons affected by leprosy?
いい質問をいただきましてありがとうございました。私は世界中を回っておりますが、やっぱりそのヘルスワーカーの皆さんの質といいますかね、非常に情熱を持って意識の高い方々が働いていらっしゃる姿は、特にインド、ネパールで拝見しているわけでございまして、先ほどお話がございましたけども、やはり研修の中に人権問題についてもですね、単なる病気の早期発見、早期治療だけではなくて、研修の中に人権の問題についても優しく説明できる、やはりそういうパンフレットを笹川平和財団で作っていただいてですね、優しく分かりやすいものをぜひこのアッシャーの皆さんに提供できるようにしなければいけないなと思いましたし、もう一つお話にありましたように、研修制度のさらなる充実ということによって、このヘルスワーカーのプライドをもっと上げてあげると、そのためのやっぱりインセンティブを何を与えるのかというクマールさんからの問題提起も、これは真剣に考えなきゃいけないと思いますので、ぜひとも何かアイデアがございましたならば、ぜひ出していただきたいと思います。今日のこのウェビナーの会議がですね、これからいろいろなアフリカでもやりますし、南米でもやりますし、この時に私たちが話す材料を今日ご出席の皆さん方から全て私たちは頂戴しましたので、これからのウェビナーを各地でやる上で大いに参考になりました。心から感謝を申し上げます。ありがとうございました。
Thank you very much, Mr. Sasakawa. I fully agree that when we think of the training program of the community health worker, the curriculum on the stigma and discrimination is very much important. And thank you very much also for giving me some assignment. Okay, so I have one more question to each of you. which is related to the persons affected by leprosy, because I really appreciate the comment made by Mr. Dinish. So my question to you is that to maintain the qualified leprosy service on the grassroots level, what do you think of the partnership or cooperation between community health workers and persons affected by leprosy? So maybe I invite Dr. Ravindra at first.
Yeah, thank you, Dr. Takahiro, for raising this very important issue, like how can the leprosy services can be more improvised when we integrate the persons affected by leprosy in the programs where the leprosy affected persons themselves will be in the front line of the programs, and they are leading the programs, and they are given the opportunity of being the champions of program developments, starting from the time of planning of the leprosy programs to the phase of implementation of those planned programs in the national level. I highly appreciate that the activity or the role of the persons affected by leprosy in the national programs will be very effective if we take them in each and every aspect of the program in terms of providing service delivery to the level where we can make the national plans and programs as well. Yeah.
Thank you very much, Dr. Ravindra. Yes, in Nepal, IDEA Nepal is doing a great activity. So I hope both the Minister of Health in Nepal and IDEA Nepal can continue to work together.
Yeah, that's true. Yeah, we do have IDEA and other organizations as well, where there are persons affected by leprosy, and in each and every activities of the national program, provincial program, and in the local level leprosy related programs, the persons affected by leprosy, they are invited in each of the activities of the leprosy control program. So we have given a very good space to the persons affected by leprosy, and when we have also realized that with their participation in such programs, the programs are being conducted more effectively.
Thank you very much. Dr. Kumar?
So 2016, when we started leprosy case reduction campaign, at that time, we also, took a policy decision that in all the activities, I mean, at the planning activities at all level, national level, state level, district level, it will be mandatory to invite a representative from, person affected by leprosy. So that was a decision taken, and in all the meetings since then at national level, we are inviting, a representative from APAL. So that is one thing, we have already done. And also, if you look at the guidelines which we have for leprosy case detection campaign, we involve them, at grassroots level for case detection activities, and support the healthcare delivery system everywhere. So that is the decision, and that is empowering them when they are part of decision making. Then they can always take a decision about better services for them. Similarly, Sparsh Leprosy Awareness Camp, it is mandatory. Sparsh Leprosy Awareness Campaign is conducted at village level. We have 600,000 villages, so it is mandatory that in each and every village meeting they are invited, and they are given some sort of recognition over there. They are felicitated. So that is the system. So involving them at all level, I think that is the way we can, demand better services. We can ensure that they have better coordination at grassroots level with healthcare workers. So this is what we are doing, and we are moving in that direction. But all this is happening everywhere. But still, we need to empower them. And how we can empower them? There need to be a system. And this should be, outside government. The government is doing something, and they will continue to do whatever they are doing. But there's something, beyond. And when I'm talking about this, I earlier also I discussed with many stakeholders about it. that how we can improve the economic status, the health status of the people. Many of them, they are in groups, they are organized, and some of them are not organized also. How we can we make a system outside government system so that they are all connected, they have networking, a good networking, and I'm not talking about the traditional networking where they are voting, they are having association, but it's sort of a networking of today's era where they are connected to the net, and they are some of them are very very poor. They are willing to work, they want to work, but whatever product they are coming out, that is they are not having market for that product. So some sort of that system, in India, I give you an example that in Tihar jail in Delhi, all the prisoners over there, they work hard and they have given a brand name to the product. So, and the product with that brand name is very popular. So that product with that brand name is sold everywhere. It's easy. People like that brand. So why can't we develop a brand for the product being produced or being manufactured by the leprosy affected people in India and national level? And we can think of the large number of leprosy affected people. They are producing something and we have given a brand name and we advertise it in newspaper, and then we have a management group managing their product, and there is demand. Now I can tell you many of these people, they can manufacture the candle. Now in India, candle is used at the most important festival, which is Deepavali, the Diwali, candle, the festival of light. Now, if we can, somehow manage that, they produce this candle, and with a particular brand name, we are able to, market the product. I'm sure all over the country in India, people will like to buy that product of leprosy affected people and use it on that particular, festival. So similarly, other products also. And this is how, we can, raise the level of their economic status, and they can be self-sufficient, and we can do much more what we are doing right now. I'm sorry, probably I have drifted from the subject, but I think this will make a change. This will make a change, and this will be a game changer. Now India, as I said, the leprosy grade 2 disability among new leprosy cases is going down, and very soon it will be very low level in the next 3-4 years. So now we have to shift our attention to those who are already having leprosy, those who are already affected, some sort of disability, so that when we say that India is leprosy free, maybe after 2030 or around that, we will also say that our people, or our all leprosy affected people, they are living with dignity, and this can be one game changer for them. This is a platform, and I wanted to use this platform to convey what I was thinking. Thank you very much for that.
Thank you very much, Dr. Kamal, for sharing a very interesting idea. I remember you shared the idea before you left the office. Now I want to invite Mr. Sasakawa, because Mr. Sasakawa, as you know, he has been one of the pioneers to work together with the community of the persons affected by leprosy. So, Mr. Sasakawa, please.
ありがとうございます。回復者の皆様方には、やはりこのハンセン病、レプロシーをゼロにするための重要なアクターであるということを皆様方に協力を世界中でお願いしているわけでございますが、あちこちで素晴らしい団体に成長しているところもございます。やはり回復者の皆さんのネットワーク、団体、そして彼らの活動に明確な我々は指針を与えると同時に、ゼロレプロシーのために協力を要請していくということが、これから私たちがやらなきゃならない一つの大きな仕事だというふうに思っております。決して回復者を一人にしてはいけません。孤独にしてはいけません。 やはり10人よりも100人よりも1000人が集まればですね、それだけ強力な組織にもなりますし、社会的に存在も認められるようになるわけでございますので、そういう意味で回復者の世界的な組織化というのも私たちに与えられた使命だと考えております。
Thank you very much, Mr. Sasakawa. The time is really running out, so I want to invite each of you for making final remarks, maybe in 1 minute or so. So, well, maybe Dr. Kamau, you can start.
No, I think today's this webinar is very important. We have come together during this pandemic time. We are learning, and we are now energized. After discussion over here, we are all energized. I can assure you that in India, we are moving, we are taking right actions, and we are moving toward leprosy-free India. And India will demonstrate to the world how you can make the country leprosy-free. So I see that very soon the world will be leprosy-free and India will be leprosy-free. Thank you.
Thank you very much. Dr. Ravindra?
Yeah, I'm very much happy and thankful to be in this very important webinar where many issues were discussed, and I came to know various aspects of leprosy, how the community level health workers were being actively engaged in my neighboring country, India. So many lessons were learned, and some important issues like the cross-border issues, the number of cases that are being treated in Nepalese hospitals, those patients who are from India, and so likewise many patients from Nepal are being treated in Indian hospitals. And so I think this type of discussion should be more elaborative so that we can have mutual understanding of management of the cases. But I agree, no, there is no any discrimination, no any differentiation in terms of patient management, but in terms of knowing the epidemiology and other aspects of the disease. I think this is a very important issue that we discussed today, and empowering the persons affected by leprosy, how we can empower them, how we can make them champions in the field of leprosy activities so that we can achieve our goal of zero leprosy. So this was another important issue which we discussed, and also the activities of the health workers amid the COVID-19 pandemic, how the health workers dedicated their work even during the pandemic, so that it makes us, all of us, feel that leprosy is not, we have not forgotten leprosy, and there are still many miles to go ahead to get zero leprosy from the world. So it was a wonderful meeting, everyone. Thank you very much.
Thank you very much, Dr. Ravindra. Mr. Sasakawa?
このコロナによりまして、逆にこういうウェビナーが発達してきたということは、私たちのお互いの情報共有を積極的にする新しいツールを我々は手に入れたわけでございますので、これをさらに積極的に活用させていただきまして、これからも皆様方の建設的な意見をいただきながら、正直言って世界的には遅れている地域もございますので、皆様方の先進的な取り組みを世界中に広め、そして同じレベルまで持ち上げていくということも私たちに与えられた仕事だと思いますので、これからもこのウェビナーを通じてご意見、ご指導をいただけるように協力をお願いいたします。本当に今日はお忙しい中、多くの皆さん方から情熱こもるお話を聞かせていただき、大変参考になりましたし、私たちが責任を負わなきゃならない仕事がまだまだたくさんあるということも明らかにされ、私たちも反省しながら前に向かって皆様方と共にゼロレプロシーに向かって努力していこうではありませんか。ありがとうございました。
Well, thank you very much, Dr. Kumaus. Thank you very much, Dr. Ravindra, Mr. Sasakawa. The time was limited, but I think we were able to have a productive discussion. I also want to congratulate all the speakers and the commentators. All the presentations are very much informative, and I appreciate the very clarified comments from the commentator. So I want to turn it over to Kiyomi now.
Thank you so much for the wonderful discussion. This brings to the conclusion now. I'd like to thank all those who presented today. Thank all supporting staff for providing technical backup and simultaneous interpretation. And finally, thank you everyone for your attendance. I wish you a very good evening. Thank you.